All right, so thank you for coming to my poster presentation. My name is Sam Gregerson. I'm a fourth-year medical student at Michigan State University College of Osteopathic Medicine. I want to talk to you today about post-traumatic falls, specifically traumatic falls, comorbid diseases, hospital stays and discharge. Does a disease make the difference? This is a good overview slide. We'll get into the specifics in a little bit here. But essentially, our project looked at patients who suffered a traumatic fall, and then comorbid conditions like hypertension, diabetes, and smoking, and if there's any association or correlation between the presence of these comorbid diseases and a higher incidence of a post-traumatic fall, more complicated prognosis compared to a healthy patient that had also suffered a fall. So falls have been shown to diminish your function, limit your activity, subsequently decrease your mobility, and also can increase your morbidity and your mortality. Um, they are very common. They make up a large portion of traumatic code activations nationwide. They make up about 44% actually in 2016 of all trauma code activations. Previous studies have looked at potential associations between comorbid conditions and more complicated post-traumatic fall prognosis, but overall the literature appears to be mixed and inconclusive. But it's understandable that people would look at a potential association because falls are a big deal. In 2017, they ranked among a leading condition that altered life expectancy, and actually the second leading cause of death due to unintentional injury. And also, studies have also looked at fall healthcare cost burden. One study showing that almost half a grand goes into healthcare costs after a fall. In our study, in our county, falls are very, very common. They make up about 2/3 of all trauma code activations in our county. And so we looked at hospital length of stay and hospital discharge patterns as prognostic indicators for post-traumatic fall patients. And we compared the presence or absence of underlying comorbid conditions such as diabetes, hypertension, and smoking to try to gauge if the presence of a comorbid condition leads to a more complicated post-traumatic fall prognosis. We hypothesized that patients with any comorbid condition had a longer hospital length of stay and overall different discharge pattern compared to healthy post-traumatic fall patients. So discharge assignment, what do I mean by that? At our institution, discharge assignment can happen from a multidisciplinary team approach, including one discharge assignment is home with self-care, meaning you get discharged home from the hospital and that's it. No further intervention required. So we consider this a routine discharge. Other discharge assignments, such as hospice, any sort of nursing or acute care facility or rehab, we lump these all together and call these complicated discharges because they involve some sort of more in-depth healthcare intervention and more utilization of resources. On the right here, in Table 1, you can see the breakdown of our patient groups. None was our control, if you will. Healthy patients, none as in no comorbid conditions. And then we have your diabetes patients, your hypertension patients, your smokers with hypertension, and your hypertension with diabetes patient groups. In total, we had 921 patients involved in our study. So, comparing these different patient groups, all back to normal or healthy patients again, which was our control. Table 2, we looked at hospital length of stay in days. The first number here on the right-hand column is length of stay in days. The next number is the standard deviation in days, and then the parentheses is your p-value. You can see that each of these, from diabetes down to hypertension with diabetes, each of these groups did not have a statistically significant difference in length of stay compared back to our healthy control group. So no significant difference there in hospital length of stay between healthy and comorbid condition groups after a fall. However, on the right, you can see we have a routine discharge column here in the second compared to your more complicated discharge assignments. And then on the far right-hand column, you have our chi-square analysis test with the p-values in the parentheses here. And you can see that your diabetics, your hypertensives, and your hypertensive diabetics these patients all had a higher proportion of complicated discharge assignments compared back to your healthy patients. So prior studies have also shown that there's no difference in hospital length of stay from specifically diabetic patients back to healthy patients after a fall. But they did show some increase in hospital complications like ICU length of stay, in postoperative infection rates. We didn't look at that specifically in this study. Other studies used overall mortality rates after a fall as a prognostic indicator. Some showed an increase in mortality rates, some did not show a difference. So overall, again, the literature nationally is mixed and pretty inconclusive. But what do we know going forward? We know that falls are common. We know that fall prevention is important from a health standpoint and a financial standpoint. And comorbid conditions or diseases like diabetes and hypertension are becoming increasingly more common, unfortunately. To date, the literature studying associations between comorbid disease and falls is inconclusive. But what we found with our patient in our county, in Macomb County, Michigan, no difference in hospital length of stays between the different patient groups after a fall. But patients with diabetes, hypertension, or a combination of the two had a higher proportion of complicated hospital discharge assignments after a fall compared to healthy patients suffering a fall. And this data suggests the importance of fall prevention and education in these particular patient populations like diabetes and hypertension going forward. And yeah, my reference is there on the right. So thank you for listening to my presentation. Hope you enjoyed it.